Perfect. So, welcome to the second equine health webinar in our 2024 series. These webinars are delivered with Michigan State University's College of Veterinary Medicine and My Horse University, an online horse management program based in Michigan State University Extension. You can use the Q&A tab to type in questions and press send during the presentation. If you are joining us from Facebook, please type your questions in the comment section. If a question isn't answered right away, our presenters will field questions at the end of the presentation. So my name is Julia Sterkota. I'm an MSU equine veterinarian and one of the leads for developing this webinar series. Tonight, I am really excited to introduce Dr. Nicole Rombach, who will be presenting My Horse is Injured, Now What? An insight into therapeutic options for rehabilitation. Dr. Rombach holds the Equinology Master Equine Body Worker certification. She has also completed postgraduate work in animal manipulation. In 2013, Nicole earned her PhD from the College of Veterinary Medicine here at Michigan State University. Her main interest is the effect of complementary therapies on equine performance. Dr. Rombach is the co-director of the Academy of Animal Sports Science, an education company dedicated to developing curricula for licensed professionals seeking quality education in animal complementary healthcare. In her spare time, Dr. Rombach produces her horses for dressage and show jumping competitions. And with that, Dr. Rombach, it's all you. Thank you.
Thank you so much, Dr. Judy. Great to see you again. It's an absolute pleasure to be back at Michigan State. So thank you all for the invitation. And without further ado, we have quite a bit to get through. So if you're good, we'll get going. Good. Thank you, everyone, for joining us this evening in Europe and this afternoon in the United States. The topic here of my presentation is really wide, but I'm going to try to condense it and make it as user-friendly, so include many tips and techniques that you can use with your own horses as what we can possibly do in a webinar. So again, the title is, My Horse is Injured, and we've all been in that stage where the world's best horse is suddenly hanging its leg or lying down as we get to the stable. And then the question is, what do we do? So here I'd like to talk you through some of the therapeutic options that make part of rehabilitation after injury. So there are a number of reasons why injuries can occur. Firstly, direct accidents or traumas. It's usually a primary issue, and depending on the type of injury, the prognosis is variable. A lot of injuries that we see come from sport-specific training, so this is often preventable. So then it incorporates looking at specific conditioning so that future issues or injuries can be prevented. And conformation plays a key factor. So the video you see at the bottom was actually of a 5-year-old mare that was shown to me as a tryout for a future jumping horse. But as you can see, particularly in the hind limbs, with that excessive fetlock drop, and although there's no injury present as yet, that was a horse that by choice and by potential predisposition for injury because of the conformation, I opted to walk away from. And then overall, when there is a case of injury, we have what we call an asynchronous or aberrant muscle function. So the horse develops a compensatory movement, motor control, which means the brain-body connection in movement is lost, and that generally results in trauma on trauma. So that's where we can dig deeper into how we can help these animals from a rehabilitation perspective. So which structures can be affected? Well, essentially the entire horse. So the joints of the limbs and of the entire spinal column, the soft tissues, so muscles, tendons, ligaments, but also fascia. So fascia is what really encases all the soft tissues, and it's a highly innervated structure, and it's certainly predisposed to injury as well. One way or the other, with injury to either the joints or the soft tissues, we have a resultant, what we would call an abnormal joint complex motion. So the muscles, ligaments, and tendons that support the joint together with the joint come into an abnormal movement pattern. And with that movement pattern, we usually get the effect of caused by an excessive stretch to the joint capsule that surrounds the joint, damage to the soft tissues that support the joint. So again, those muscles, tendons, ligaments, and the joint capsule itself as well. And then the actual process of inflammation. And we'll touch more of that on that as we go along. But before digging into specific rehab, it's important to understand the phases of tissue healing. So when an area is injured, so for example, a tendon is sprained or a ligament becomes ruptured, the initial stage of inflammation is where we typically see heat, swelling, and pain. So in those early days is when you would apply things like you see here in the picture, an ice boot, for example, to a lower leg to help control some of that inflammation. Then the healing moves into the stage of proliferation. And again, that's about 10 days after injury. It's all somewhat variable. It involves stages of tissue granulation, the wound contracts, and scar tissue starts to form. And then the remodeling phase is the phase that is so variable and often, from a rehab perspective, the most challenging to deal with, because that can take anything from weeks to over a year, depending on the type of injury that the horse has. These phases of tissue healing often overlap, so there's no clear definition from phase to phase to phase. And furthermore, the healing can be complicated by things such as an infection or compromised blood supply. When you think, for example, of tendons and ligaments, which are highly avascular, so there's little blood supply to the area, which again changes or delays healing phases. One way or the other, when you have an incomplete healing, so an injury that has not healed completely before the horse returns to work, it can lead to chronic conditions because of an impaired function over a prolonged period of time. And then, of course, there is the delineation between the type of injury or condition that the horse has. So healing phases for musculoskeletal injuries are quite different from those that are due to neurological conditions. And tissue healing of different structures, anatomical structures, is also highly variable. So when you're looking at bone issues or bone disease or fractures, you're looking at whether the bone is stable or whether you have an issue of an unstable fracture. Was there a need for surgery? So with bone injuries, you look at 3 weeks to 3 months. And joints overall are very challenging, again, depending on which structures are involved in the injury. Tendons can take 12 or more months to heal. Ligaments, same thing. Muscle healing, depending on the type of strain or the type of injury, anything from a month to 3 months or even longer. Skin is an interesting one, and there's some nice research that came out to show that it actually can take up to a year for skin to regain only 70% of its original strength. And again, that has a lot to do with injuries to the fascia under the skin. Neurological conditions like EPM obviously are highly variable. And then, of course, there's the issue of a combination of tissues that can be involved in an injury. The common denominator in the determination of how tissue heals is really the concept of pain. And we'll be touching on that as we go along. Firstly, when we're looking at rehabilitation, we know that we want to return the horse to normal function and movement, but how is this movement actually created? So movement or locomotion comes from the actual muscular and the fascial, so the myofascial system. That is what creates movement. It's created through coordination, first of all, of the central nervous system, so the brain and spinal cord that send messages to the muscle in terms of how it should move. And that works synchronously with the peripheral nervous system that receives sensory input from the outside to again guide the brain into how it's going to create this movement. The skeletal system is your actual axis for movement, and then you get a combination of biomechanics, so forces like gravity and inertia, as well as balance and coordination that all come together to create movement. So all these factors need to work synchronously to have muscles create movement. But then we have the issue of pain, which comes with injuries. So in the short term, pain is a wonderful adaptation by the brain. It immediately adapts movement, so it's brain to body warning to not carry out a certain type of movement or remove itself from pain. So, for example, if a horse has a stone in its shoe, for example, the first thing it will do is avoid weighing that foot because the pressure of the stone in the hoof creates pain. So again, that's the brain producing this adapted movement. So it really is an avoidance of a movement that creates pain. In rehabilitation, however, we usually deal with cases of long-term adaptation to pain. And in the long term, the brain-body coordination is affected and it becomes a maladapted movement or a compromised movement. So what we aim to do there from a rehab perspective is to first of all optimize the horse's posture in standing and then in movement, so in loading. And that means that we need to retrain specific brain to body connection. So motor learning in the brain is key in that phase of rehabilitation. So the aims of rehab, first of all, primarily removing pain. So again, that goes back to the different phases of tissue healing and how long pain is present for. Pain is the highest overriding factor in the brain. So long as an element of pain is present, there will be a compensatory movement. The second part of rehab is to restore range of motion. So by now the horse is pain-free, so we want to restore how it moves normally. So free range of motion. And again, that time period is variable depending on the type of injury and the structure that was affected. The final and what I find the most challenging, positively challenging part of rehab is to restore function. So this means rebuilding strength, retraining motor control, so that connection between the brain and the body. And that involves designing an individualized program so that the horse can return to symmetry of movement and, what is very important, dynamic stability. When we look at removing pain, this is primarily where your veterinarian plays the key role. So clinical-based approach. So pain control can either be focal, so at the area of injury, or more global, so involving addressing the entire horse, so systemic. So you might get something like a PRP injection into a suspensory ligament lesion, but at the same time, the horse might be given a systemic medication to, again, control pain. So often those two are combined. But complementary therapies can also be very useful in pain control. And this can involve a variety of therapies. So from a soft tissue perspective, anything like massage, chiropractic, osteopathy, acupuncture or acupressure, any type of manual mobilization therapy. You see on the bottom right image an example of mesotherapy, so subcutaneous injection with substances that help to control pain. So that can be anything from vitamin B to Serapin to any cocktail that your veterinarian likes to work with, and that's appropriate for the horse in its particular case. Icing is very useful, and electrotherapies are also very useful in pain control. So chatting a little bit more about electrotherapies, because once the horse goes home for rehab, these are tools that you will likely see that your veterinarian or practitioner uses. First of all, for use of electrotherapies, the injury needs to be determined carefully. So you need a clear diagnosis. And then the veterinarian, together with the physical therapist or sports therapist, will design an appropriate rehabilitation program. And then within that rehab program, specific electrotherapies that are appropriate for the horse can be integrated into that rehab program. But it's really important to understand the function and the effects of the different modalities. And different modalities include TENS, so transcutaneous neural stimulation. So that is the bottom left, you see an example of that, a little machine that sends electrical currents through electrodes onto the skin, so it can actually override pain factors. There is also neuromuscular electrical stimulation, which is where actual a machine similar to that actually offers contraction of specific muscles. So again, it's important to know where the electrodes are placed over anatomical regions to use that muscular stimulation effectively. Then there are different types of lasers. So the cold laser, which is class 3, the class 4 laser, which is also known as a hot laser. Then there's also shockwave therapy, functional electrical stimulation, which is another type of neuromuscular stimulation, and then the magnetofield therapy. So there are a number of those available. So you'll see that on the top right-hand side, and then the bottom where you see the Activomed blanket on the horse there. It's also a type of PEMF therapy. So again, it's very important when working with these to make sure that the practitioner who comes to work with the horse can use clinical reasoning. In other words, is this type of therapy appropriate for the horse? And can use critical thinking. At what time in the healing phase and in the rehab program are these electrotherapies safe to be introduced? Then the second part of rehab is to look at restoring range of motion. And that can either be very focal, so again, zoning in on the area of the injury. And that's where it's important to understand how the horse moves normally so that you can identify where there is an adaptive movement. So the top images show you the horse standing on a slight slant. The one on the left, the image is 5 degrees, and then it's 10 degrees on the right-hand side. So if you have a horse that has, for example, a deep digital flexor injury and it's returning into work, this kind of passive, almost a stretch or an elongation of the tissue can be very useful in the restoring range of motion phase of rehabilitation. But it has to be appropriate for the horse. So it has to be concurrent with regular ultrasounding, to accompany the healing of the lesion to make sure that there's not an excessive strain that is placed on the leg for that particular case. So in each case, you would start off first with the horse standing on the ground, carrying out some exercises that I will talk you through as we go on. But then these slight slant platforms are really useful. But the one you see on the left would be appropriate for the initial introduction of restoration of range of motion. You would not start immediately with a 15-degree wedge. That would be way too much stress on that structure. And together with that, there's also the global or full body approach with returning or restoring to range of motion. And that involves controlled exercise. So it's the dreaded time when the horse, and I remember it well personally in mid-Michigan winters, having a horse post-surgery, that can only be hand-walked, and that was exciting. But the controlled exercise part is really important, because it gets the whole horse moving, because the effect of stable rest can't be underestimated, because a horse on stable rest is essentially the same as a human patient on complete bed rest. So a lot of the supporting musculature, the core musculature at this stage, is essentially just wasting because the horse is not moving. Usually at this phase of the rehabilitation, you're still on reduced turnout. So again, the factor or the combination of prolonged stable rest, reduced turnout, and the boredom factor need to be considered. So if you have access to something that you see here on the bottom right, like an overland treadmill, that's a really nice way to exercise the horse, because you have controlled velocity, you can time your session precisely. And because of the way the treadmill uses in difference to the horse moving over land, in some ways it places less strain on certain phases of the gait. But to return to full function, which is our final aim of rehabilitation, and which I find the most exciting and challenging part as well, it's really important to work with critical thinking, and clinical reasoning. It's a really gray area to define or to differentiate when you're dealing with clinical factors. So there's still an element of pain. So again, those healing phases that we spoke about, they're not delineated or not mutually exclusive. They do overlap. Or whether you have an adaptive movement over time. So if you're dealing with a mechanical compensatory movement. But one way or the other, both of these lead to what we call dynamic instability. In other words, the horse is not stable during movement, and that's where we can become very specific in our rehabilitation program to return that dynamic stability, a symmetry of movement. One thing that's really important, and if nothing else as a take-home message, would be that pain and the compensatory movement are not mutually exclusive. They're closely related, and they're both regulated by the brain, so by the central nervous system. So pain, if there's an element of pain, it will alter the movement pattern. But with an adapted movement pattern over time and the suboptimal loading on joints and on the soft tissue structures, pain can either persist or recur or set up for another injury. Really, really important that when pain is resolved, normal movement patterns will not automatically reactivate, so the normal brain to body connection does not reset. So from a rehab perspective, we have to look at both controlling pain and changing the adapted movement patterns. So a little bit about motor control, which I've spoken about a few times already now. So it's again, central nervous system, so the brain and the spinal cord working together. It's the ability to coordinate movement. So muscle and joint function so that the horse can move optimally without straining either soft tissues or joints. And that relies on an integration of feedback that flows continuously between the brain and the body. So environmental feedback is also known as proprioception. So the outside or the periphery integrates information with the brain. And that integration together has that you have an appropriate motor response. So we see here a horse in collection and dressage. So that horse has to be dynamically stable, so stable during movement so that it can sustain that collection that you can clearly see here in the picture. So why do we focus on motor control in rehab? Well, we know that if there's an injury or an illness, or like a neurological issue, for example, normal movement patterns alter. So our goal here is that we can either restore or enhance effective movement so that the horse can move and work pain-free. It's functionally mobile and it's stable during movement. And there are a number of components of motor control that are key in rehabilitation. I'll list them here and then I'll talk a bit more about each as we go through the lecture. But first, the brain-body connection, the feed-forward and feedback control, and I'll elaborate on that in a coming slide. But muscle activation needs to be effective. So again, you need to have an intact neural connection, so a nerve connection between the brain and the body. So this is where it's challenging when you have either neurological conditions like EPM, where you have had a case of surgery, for example, for kissing spines, because that cuts through muscles, it forms scar tissue, and again, the fascial system is disrupted. And the muscular system is disrupted. So the normal muscle activation pattern by virtue of that is also inhibited. The horse needs to have adequate postural control, both in standing and in movement. The sensory system that allows proprioception, so the awareness of the body and space during movement, that needs to be intact. And overall, we want a coordination of movement. So muscles need to work synchronously to create movement. So from a therapeutic perspective, we're going to see how we can best assess and address where there's a deficit in a movement pattern. And that involves an individualized therapeutic program. And that's multimodal. So by multimodal, I mean that it involves different techniques, different therapies, certainly clinical attention as well, again, pain control, and overall putting that whole team and that whole toolbox together so that we can create stability and movement. So a little bit about the feed-forward and feedback mechanisms. The feed-forward mechanism is a part of the brain that it has an anticipatory action. So what it will do is it will fire up specific stabilizing muscles, which will position the joint optimally for movement. These are usually deeper muscles or those that are connected closer to the joints, and they're usually made up of type 1 muscle fibers. It's the feed-forward mechanism is one of preparatory stabilization. So typically, these muscles will fire milliseconds before larger muscles fire to create movement. The feedback mechanism is one that offers specific responses after a sensory input. So how is the horse going to jump over a fence? How is the horse going to deal with a change in terrain, for example, on a cross-country course, jumping down a hill or from land into the water? So this involves coordination of movement muscles. They can make adjustments within the movement to, again, keep the joint positions as optimal as possible. And these muscles are usually made up of type 2 muscle fibers. So to give you an example here, pardon me, understanding a little bit more about how muscles function, the more superficial muscles are usually made up of longer, more parallel muscle fibers. These can create a greater range of motion or range of movement under a lower tension, have a fast velocity of contraction, and depending on where they attach, they can affect motion of numerous joints. So here we have an example of the brachiocephalicus muscle, so the long forelimb mover of the thoracic limb, of the front leg. So it has attachments in the neck, direct attachments in the or onto the lower neck vertebrae, but it also crosses the shoulder joints and attaches into the forearm. So based on its attachment, brachiocephalicus actually has many functions. It can create movement in the neck, but it's also a prime mover of the forelimb. So again, understanding a little bit about the anatomy, where muscles attach, will make you understand how movement is created and where you might have issues with normal movement. So the deeper muscle fibers are usually shorter fibers. They have a more pennated angle, so they're more angled versus the parallel fibers of the superficial muscles. They are usually type 1 fibers. They can create force and stability over a sustained period of time. And again, depending where they attach, they can make very focal changes in shape and in support of joints. So here we have an example of the deepest muscles of the neck of the horse. This is the atlas of the first vertebra of the neck. The head would be here to your left. We still see a little bit of nuchal ligament intact. You see the ribs and the sternum here. And these are the deepest muscles, so multifidus, spinal extensor, and longus coeloe, spinal flexor. And these work synchronously to give stability and support to the neck during movement. So these are the feed-forward type muscles that would fire milliseconds before brachiocephalicus. The more superficial muscle would fire to create movement. So in this way, we have both stability and movement as the horse goes through locomotion. So again, a little bit here on the back of the horse, so the superficial muscles of the back. This long muscle group here comprises 3 different muscles, so longissimus, spinalis, and the costalis muscles as well. Sorry, I'll get back to that in a moment, but what I really wanted to show you is that these iliocostalis, there we go. So these three muscles are all longer muscles. They attach from the pelvis all the way into the lower neck of the horse. So whenever you see a horse that has a really inverted back posture, you always wonder whether these muscles are in a state of sustained contraction. And we'll talk in a moment about why that might happen. So these muscles both stabilize during movement in a contraction, but they also permit range of motion. So movement of the trunk and then of the lower neck. They work very closely with the deep muscles of the back of the horse. So here is an example of one of the deep back muscles. The multifidus muscle that I mentioned in the neck actually runs all the way in along this thoracolumbar spine, so the back of the horse, into the pelvic region. So it's a key stabilizer of the spine. What we know from research is when you have an issue such as kissing spines, this muscle will actually atrophy measurably at the site and the side of the lesion. Now, this deep muscle needs to work together with the superficial muscle, again, to have stability during movement. What we know from research is that where you have a clinical dysfunction, so for example, in case of the spinal column here, arthritis in the neck joints or kissing spines in the back, muscle behavior will change. So the superficial muscle that was initially there to create movement often becomes very braced, very tight. So if you palpate the horses, or if you look at them like the bottom right here picture, it looks like it's a clipping of where the saddle would sit, but this is actually muscle atrophy in this horse. So whenever you see this, you always want to question whether there's something deeper that is going on. Because what we know is that the deep muscles that have to stabilize lose that function of stabilizing. So the superficial muscles now have to do both. They have to stabilize against pain, but they still have to create movement. So you can see where in these horses that have really tight backs and where they're sensitive to palpation or even to brushing, having the saddle put on and so forth, when that goes together with atrophy, you'd also always want to question why that might happen. Same thing for the hindquarters. So here we're looking at the gluteal muscles of this horse. It was actually the same horse as the one that you see here on the right. And you can see instead of a nice round muscle shape, we have atrophy that happens. And one of the adaptations of muscle to injury is that you will have what we call neurogenic atrophy. So the muscle will atrophy or diminish in size because of lack of neural input. So lack of motor input, motor control. And here it's not so clear with the light, but in the neck of this horse, this was a horse that was called the C4 back pain, a dressage horse, but it actually had so much atrophy along its neck and it was really painful to palpation. And when we x-rayed it, it was clear that it had some significant arthritic changes in the neck. So again, normally you want to see this neck musculature nice, plump, evenly developed. Whenever you see the divots around the vertebrae in the neck, you would question why. So you would want to investigate that further clinically. So here are some examples, and it's always a chicken and egg thing. Is it a primary issue that causes the muscle imbalance, or is it something that the horse is living with and it's adapted over time? So this horse here on the left tore its superficial tendon off the hock. And this is 6 months post-injury. You can see that the hock is still significantly swollen. But if you take a look higher up, you can see how the entire musculature on this hemipelvis, on the left side of the pelvis, has atrophied. You can see the gluteal muscles, the main stabilizer muscle, the biceps femoris muscle, some quadricep muscle, some Gaskin muscle. So this is significant atrophy. So this horse's rehab focused not only on the healing of the actual lesion in the hock, but also addressing the secondary atrophy that had set up through the body. This horse here is quite a different story. This was a Grand Prix, International Grand Prix dressage horse that presented with this musculature on when I went to work on him, but he had huge hock issues. You can see here the hocks are tremendously swollen. So the treatment for him initially was to control the arthritic changes, the degenerative changes in the hocks. But it obviously had a very significant secondary effect on the musculature higher up. Now, this horse was functional, so I would call this a mechanical shortcoming versus this is a clinical shortcoming, and this would be more mechanical. So the horse has an adapted movement and adapted muscle development because of the primary issue of the hock arthritis. So it was still able to function. It competed internationally at FEI level, but this is what we had to take care of from a rehab perspective. And then again, here is another example of neurogenic atrophy. This is shared from a colleague of mine, Dr. Ravenor in Oregon. And here you can see the horse that presented with caudal neck pain, so not uncommon to have arthritic changes in the lower neck. And it shows, this horse shows clear atrophy in the pectoral region, the deltoid region, the subclavius. So again, all supporters or stabilizers again of the shoulder as well. And this is what the horse looked like 8 weeks after treatment when Dr. Ravenor injected around the nerves and into the facet joints in the cervicothoracic region, so in the lower neck region. So again, pain control is everything before starting a rehab plan. Then we'll talk a little bit about the horse's core. So essentially the core of the trunk is the bridge between the body, so the axial skeleton, and the limbs, or the appendicular system. And the core is designed to provide stability and movement to the entire spine. In this case, you'll see some of the images here on the right, both deep, so your psoas muscles, and we have multifidus muscle higher up here. We have longus coeli in the lower neck, and we have the superficial, very important abdominal and oblique muscles. But each joint complex has its own inherent core stability system, including the limbs. So, for example, the shoulder complex has muscles that attach, that provide stability and movement, as does the elbow, as does the carpus. So all these supporting soft tissues need to be functional and in order to provide stability to those joints in movement. So core strength, whether it be the trunk or in the limbs, is really essential to prevent further injury or pain. So when you see or you have a suspicion that you might have an issue with core strength, the classic sign is that you get the horse with the hollow backed appearance, and we've now seen how those long back muscles attach all the way into the lower neck. So it's not just the spine that is held in extension, and when the spine is held in extension, it essentially compresses the joints of the vertebrae in the back and the neck. There's also the physical appearance. So again, we already saw that you can that there's the development of atrophy that can be in any region that is affected. Here, in the case of the back, you'll see it over the lower neck muscles, and in the long back muscles, also the hindquarter region. Clinically, these horses, when we're looking at the core of the trunk, they'll present with neck or back pain, and they often have an accompanying lameness, low-grade lameness, either in one or multiple limbs. And generally, the performance is affected. So owners will complain, or riders will say that the horse is reluctant to work round under saddle. So it'll have that raised head and neck position. It'll hollow under the saddle. The hind limbs won't push through. So again, that lack of hind to front connection, and very important impulsion. So always also important to look at your phase of the gait. So here in the swing phase of the trot, this horse has a rounded lower back because the back is in spinal, what we call flexion. So the abdominal muscles are working and the oblique muscles are working effectively to have that spinal flexion. But then in spinal extension, when the horse is in full stance phase, the back goes into what we would call a stabilized extension. So those long back muscles will also work to stabilize against excessive extension or dropping of the back. So when you look at the horse, it's really important to look at the phase of the gait when you're looking at how the spine is moving. So here's a different example away from the spine. Here you have an example of some severe degenerative joint disease in the hip of the horse. So it's a ball and socket joint. And here you would actually see the ball part. What is so important when you're looking at core muscles, and I also haven't mentioned yet, but muscles don't work on their own. They work synchronously and in chains. So all the muscles throughout the body are connected. And for those of you who are interested, there's a wonderful team of researchers in Denmark, Dr. Elbund and Dr. Schultz, who've done beautiful work at looking at myofascial chains in horses. So you can look up their work. It'll come up easy in a Google search. But in this hip joint, just to contextualize that for you, one of the long abdominal muscles, the rectus abdominis muscle, actually attaches directly into the hip joint through the accessory ligament that we can see here. So in real life, you see the long abdominal muscle, which is key in trunk core control or trunk stability. It attaches directly into the hip joint of the horse. So in a lot of cases that you see where the horse has poor standing posture, it's in spinal extension, the abdominals are not functioning as they should, we don't have just the effect on the joints in the back and as well as the sacroiliac joint complex, but often the hip joint is also not loading or not supported or stabilized effectively, which then in turn has an effect on the stifle, the hock, the fetlock, and so on. So that's why, again, it's important to always look at the entire horse. So in the lower neck of the horse, there's a key muscle that works to stabilize, again, in movement. So this is a friend of mine. He's a Grand Prix jumper. He's landing over a 145 fence here. So the velocity and height of the fence, the velocity of the jump, the landing after the jump, the weight of the rider, all has to come onto this scapulothoracic area, so the lower neck and shoulder area of the horse. So you need to have effective stability there to work against the gravitational forces from the jump. So the serratus muscle is a key muscle that we work with as well. It has a portion in the back, so the thoracic portion, but it also attaches directly onto the lower neck vertebrae to support there too. This lies directly under the scapula, so under the shoulder blade of the horse. That would lie here, it's been removed. And this is the only muscle that connects the forelimb to the trunk of the body. So it's, or to the body of the horse. So it's really important that together with the deep stabilizing muscles, that this serratus muscle is functional to support the horse. So when we're looking at strengthening from a motor control perspective, what we want to do is enhance performance, prevent re-injury, and use exercise-based types of muscle activation and different approaches to rehab to promote dynamic stability. Usually I'll start with the horse in standing, so statically, and then gradually bring that over into ridden work using things like kinesiotaping or the equiband, which we'll touch on as well. Starting off, it's always interesting to see how is your horse posturally. So a very easy way to do that is to have the horse square up and give a gentle abdominal activation to see how much he's able to lift that back. And in a horse that has a really weak core or has a really bad posture, for whatever reason, you'll find that when you do this, you get a huge lift of the back. And the horses that have a stronger core stability generally have lesser lift of the back. When there is no lift at all, that could be something that you want to investigate clinically as well, but that will be for another lecture. So here you see two examples, slow motion on the left side and real time on the right side of a stability test for the horse. So looking at the video on the left, again, this is in slow motion. What I'm doing is offloading the forelimb of the horse and giving a push to the shoulder, towards the hip on the same side of the horse. If the horse is stable, it will not need to shift its weight to stand. So this horse on the left is stable. When we look at our horsey on the right, and this is real time, you see that when the practitioner lifts the limb and asks him, and this is a very gentle shift, this is not done with force, but puts a hand on the shoulder and shifts back to the right side here. In this case, the horse again will need to reposition. So he's failed his static stability test. What that means is if it's not stable in standing, it won't be stable in movement. So in a lot of horses like this, you will find that they, for example, speed up when they're being ridden or lunged on one side compared to the other. Again, speed creates balance. That's why when you have your horse evaluated on the lunge, for example, we often like to see the horse trotted or cantered as slowly as possible because it gives us a better idea of the true stability of that horse. Then, following the posture assessment, so statically and dynamically, it's time to get into some hands-on work. So that starts by mobilizing or loosening tissues. So you can either work over soft tissues or over joints. So either increasing soft tissue stretch, so again, loosening muscles, working over muscular tendinous junctions, and passive stretching over joints to affect the joint capsule and again the ligamentous and tendinous attachments, or working over joints directly. So using things like low-grade joint mobilization, chiropractic adjustments, osteopathic approaches, and so forth. Or as you see in the bottom picture on the right here, and I have a live example of that in a moment, lower back rounding, again to create joint range of motion. But any mobilization needs to be followed with activation so that you can actually create a change in the motor control center of the brain. So activation is any type of external stimulus that will elicit a movement, so a muscle contraction. So you can either activate one specific muscle or an entire muscle group. And by virtue of moving the muscles, you also affect the joint range of motion. So in real life, it would look something like this. If you'd want to activate the abdominal muscle group, for example, and we see some diagrams here, superficially you have your long or the straight and the transverse abdominal muscles, or the oblique muscles. Deeper, you have your psoas muscles that provide support to the spine in the lower back. So you can carry out either these exercises in standing, or then, as you see me do here, a very gentle rounding and activation, and you can visibly see a really nice activation of the abdominal muscle group. Here we do it again through an abdominal lift. Some horses are not keen on these exercises, so it's kind of picking whatever the horse prefers, but there are a number of different ways in which we can approach this. I'll show you a few other techniques as well. Now, these don't need to be large ranges of motion. What we're doing here is specific muscle activation, so less is often more. So here I'm carrying out what we call an isometric activation. It's using the tail of the horse, and it's a very gentle destabilization in a backward direction. One of my clients in Chicago described it beautifully. She's a dressage rider, and she said it's like doing a half halt with a tail. And that's really, if you keep that in mind, a very useful way to look at it. So visibly here, we see activation of the hind quarter muscles, all the way forward of the abdominal muscles, the oblique muscles, the pectoral muscles here in the front. You see oscillation as well of the lower neck. Beautiful way of mobilizing. But then when we take it a step further, this is using real-time ultrasound, which I like to do. At the same time of doing this exercise, I am imaging multifidus and longus coeli, so the spinal stabilizers in the neck. This here, I don't know if you can see the mouse, I hope you can, is actually a facet joint in the neck. So it's a beautiful way of a passive mobilization of that neck joint without having to work over the actual joint. So this is really useful for horses who've had lower injections for arthritic changes, for example, in the lower neck. Same thing here with longus coeli in the lower neck. Beautiful way to activate that muscle without having to work directly over the muscle. So this exercise I leave with most of my clients. I use on my own horses daily because it's one that really activates all. You can't really see it so well from here, but it's really useful for activation of flexors and extensors in the limbs as well. So really useful to integrate for horses who've had distal limb injuries. So for example, coming back from tendon or ligament injuries. This ultrasound here I haven't discussed yet. This is multifidus in the back, so at the level of about T12, T13 in the thoracic spine. So more or less under the area where the rider would sit. In this exercise, you can see multifidus activating. And again, that's the muscle that we know from research will atrophy when there's been an injury, or for example, in surgical, when it's been addressed surgically in like a kissing spine intervention. But this is also beautiful mobilization of the facet joints in the back. So again, this exercise is so nice. Most horses tolerate it really well. Very useful to do on stable rest. It's a beautiful way to keep the core active when the horse is actually not allowed to move. You've probably seen many publications or articles about these baited activations. They're not stretchers. It's something quite different, but here using a treat or clicker training to get the horse into the different head and neck positions. It's really intended to activate these core muscles, both superficial and deep. And there was some nice research that came out of Michigan State that actually showed that these exercises, when done on a daily basis, will again hypertrophy or activate the multifidus muscle, which again, key stabilizer of the back. So both for superficial and deep muscle stable activation, this is a really useful exercise. So a little bit of trivia here. Stretching increases range of motion. It actually reduces muscle strength or activation, so motor output. And usually these stretches are carried out in a sustained hold for 15 to 30 seconds at a time. Whereas activations actually increase muscle strength because it's an instant recruitment of your motor unit, so the brain-body connection fires up, and these are very fast activations like you saw in the isometric activations with the tail shift. So again, when you're looking at these stabilization exercises, you can work with your therapist to devise a number of different ways in which you can activate muscles and make it more challenging, neurologically challenging for the horse. So by teaching them to offload a limb, for example, or by putting them on an unstable surface. Like here I have my horse on some stability pads. This is really great. I just had one of these made and I'm super excited about it. A wobble board. It's really a great way to activate the horse's core. It's really useful for horses in rehab for so many reasons and to address so many different structures. And it's a really nice, gentle way to do this. So useful for horses who had either injuries to the neck or the back, but also to the lower legs in the appropriate phase of healing. Then dynamically, once the horse starts to move, to engage the core muscles and get symmetry of motion of the back and of the pelvis, we work with the Equiband system. Some of you may already be familiar with it, and you can find more information on the website that's cited below. But there's already a nice body of research out, independent peer-reviewed research that shows that use of the band system really promotes that symmetry of movement by a continuous activation of these resistance bands, either under the belly or behind the hind legs or in combination. So there's actually a free course on how to use it. So I won't go into too much detail on it now because I know we're short on time. But this band system is really useful because you can use it in hand. The horses can have the system on when they're in the horse walker, on the treadmill, and the underwater treadmill as well. So it's safe for use under many conditions, and there's no direct connection with the head. So it leaves the head and neck, particularly the neck, free to balance itself, and that's all a key part of dynamic stability. So here we have an example. This is little Kokomo in Canada. And when you watch him on the left, we see that he's slightly unsound there on his right front. But to distinguish whether you have a clinical or a mechanical issue, you can use core activation. So what we did is we put the abdominal band from the equiband system on him, and you can see that what looked like a lameness, that mechanical adaptation, actually disappears. So again, once the core is stable, the limbs will move symmetrically. But conversely, when you use the equiband, sometimes that can bring out a lameness as well. This is why it's really suggested only for use under veterinarian or licensed professional guidance. This is a stallion that belongs to a friend of mine in Germany. He's a Lusitano stallion. And he presented with some lipping, some arthritic changes in the lower neck. And the top video is actually him after having had an injection in the lower neck. So he'd been treated, but we still had that movement dysfunction. So in addition to a series of ground-based exercises, we also put the thoracic sling system, so like a little shoulder sling system that we have in the equiband system on him. And that was enough to activate the stabilizers of that lower neck area. And you can see how his movement becomes almost regular. So again, that was something that was incorporated into his rehab regime. So this is a young stallion I was working with in Portugal, and the rider had complained he was doing the 130s, 140s, but she complained that he'd started to stop. He would only get deep to jumps, not jump for long, and then this kept on happening. So he took a few partial and full tumbles. So we radiographed his neck, and he had some changes in the lower neck on the right side, nothing too big, but it was treated anyhow. But what was really interesting is that he was very weak on a sway test. And when I did the passive mobilization of his lower neck, he felt almost hypermobile. So the whole lower neck felt unstable. So he went through a series of ground-based exercises of release and activation. Here he's working with the abdominal and the thoracic sling band on. So he's gaining his strength. And this is him about 6 weeks later, back to jumping up to full height, jumping from distances, no longer stopping, and able to clear the fences. But what was really interesting is that this horse also showed up with a lack of vitamin E. So that's very prevalent here in Portugal because there's no grazing and the hay is abysmal. So again, when we talk about clinical reasoning, don't put all the eggs in one basket. Always consider the physiological state of the horse as well. So together with his vitamin E supplementation and his rehab, this pony went back to jumping very nicely. Now, it's not just the core, the trunk that we give attention to, but in rehab, we also want to retrain movement of the limbs. And one way in which you can do that, again, by proprioceptive input to retrain that motor control is by using something called a proprioceptive bracelet or a jangle. So this was also, there was a study that came out of Michigan State on that to show how it affects movement positively on the horse. So it has an effect on joint range of motion in the limbs, but this is what it would do in real life. This is a client of mine in Michigan, was a client because I'm no longer in Michigan, but we wanted to activate his right hind. So he has a little bracelet on the right hind. This is in slow motion, but you can appreciate even the carryover from, it's not just the right hind that is getting the input, but the brain also sends a signal that the left hind will lift higher and move more than normal. And I think he moves into a trot here. Yeah, and you can see how he, by virtue of putting the bracelet just on the one limb, you get increased range of motion in both hind limbs. So the caveat there would be is if I'd had a horse with a serious right hind injury and I was retraining movement, I would probably start by putting the bracelet on the left side so that I'd have some increase of motion on the right, but not as much as what we see here. So these bracelets are really useful, and depending on where you put them, which height on the limb, you can affect the movement of the limbs in different ways. One question that always comes up, which is why I included it here, is if you have a case of acute back pain, what do you do for rehab? I personally don't delay and I start immediately. So kissing spine surgery, you see an image of that, the horse post-surgery here at the bottom. I start with them pretty much immediately because atrophy sets in within 72 hours after there's been an interference or an insult to the muscles in a certain area. So what we really want to do is maintain range of motion even within this phase of healing. So for me, early mobilization is really important. So I will start with a combination of tail shift exercises, gentle abdominal lifts, keeping the spine in neutral. No rounding exercises per se, but that's where these tail shift exercises are really useful. When the horse is still in hospital, get it walking around already. And as soon as it's at home, I'm all for getting them walking as much as possible and then putting together a very specific core strengthening program for this horse. And there's a full course on that on the link that you can see on there for anyone who's interested. But then part of the rehab as well, as we progress through the final stages, is cross-training over different surfaces. So again, proprioceptive stimulation from a different perspective. Now, the inclines are great, especially when you're going downhill, because it involves what we call eccentric muscle contraction, which is key in motor control. And the slower the horse moves, the more of a challenge it creates, because again, the faster they go, the more balanced they are. So working over different inclines is really useful. Then you can incorporate ground poles as well. Again, beautiful way of using different types of proprioception and breaking up adaptive movement. Again, this is using the equiband system here. And then ridden, you can also use, which I'm very fond of, different types of formations with poles. So this is the first time my little mare here was going through these types of exercises. And here as a rider, you can get very specific. How many times do you want the horse to step between the poles? Like here we're going higher. I only want 1 footfall, but we cheated at behind and we got 2 footfalls in there. So again, there are many great exercises, books and online guides on how you can use these. Also working over poles that are raised alternately or on one side only. So it really depends on what you want to rehab. This is really useful for horses that have had neurological conditions as well, so like EPM cases. And one of the questions that always comes up is, do you swim the horse or not? So swimming from a cardiovascular conditioning perspective is really useful. It's also a really nice weightless exercise for horses that have had distal limb issues, so lower leg issues. But for horses with back or neck issues, it's actually not indicated because it places the spine into extension, which again places the excessive force on the joints. So it's not indicated for that, but you can use an underwater treadmill, which is really useful, which is really beneficial, both for cardiovascular conditioning, but then also core strength training. So you can see the horse here is in the underwater treadmill, and in the bottom video you can see that he has the full equiband system on there, and you can see immediately how that changes the position of the head and the neck. So it's really nice to combine those two together, the water treadmill and the band system. And then clients always ask, well, what else can I do to help my horse? We've got massage guns, we've got vibrating blankets, we've got saddle pads that promise to cure everything. For the most part, there's very little validated research on these products, and the claims from the manufacturers are very questionable at best. But of course, it's an easy market because all we want to do for our horses is give them the very best. But at best, these tools won't do any harm, but at worst, they can cause irritation and hypersensitivity, like the handheld massage guns that I see that are going quite wild. And again, what is so important, if you're looking to change motor control, so how the horse moves, release alone is not sufficient. So if using any of these tools to release, follow it up with activations and something like that simple, straightforward, tail back isometric activations are absolutely ideal. And listen to the horse, let him know what he likes and what he doesn't like. So just to finalize here, when you're looking at rehabilitation, and yes, we do make a little equiband set for minis, it's imperative that first the horse starts with a solid clinical diagnosis, because without diagnosis, it's impossible to set up an appropriate rehab program. Obviously, primarily pain removal, and then working towards increasing the range of motion, and then coming to fine-tuning the exercise program to a return to full function. But that really means teamwork, which is so important. So the owner, the rider, the trainer, primarily the veterinarian, but also the therapist, the nutritionist, the farrier, the saddle fitter, the dental technician, an appropriate conditioning program, and so forth. And client compliance here is really important. And that's really hard because when you have a horse that is on a 6 to 12 month recovery from an issue, it's really hard to keep them motivated. So leaving homework for the clients, keeping them involved, and having always that consistent reassessment from everyone in the team is really important. And that all together should give a good prognosis for recovery for your horse. So thank you all so much for being here and listening, and I'll gladly take any questions that you may have.
Thank you, Dr. Rombach, for a wonderful presentation. I'm going to go ahead and switch and share my screen here.
Should I stop sharing my screen, Julie?
I think I overrode you anyway, so I think you're okay.
Okay.
I think you're good. So we have a few questions that have come in, and we'll answer a few of these, and then we'll do our prize drawings. So does chiropractic care have a place in prevention and treatment of pain/injury? If so, how should you look to identify a reputable practitioner?
Very good question. Yes, it does, because it's a type of joint mobilization that is, depending on how the chiropractor works, very beneficial for the horse. I like to combine it together with soft tissue work, so not just chiropractic, but soft tissue work together. And the two absolutely work for maintenance. And like post-kissing spine cases, I'll adjust as well. How to find a reputable practitioner, very good question. In the USA, look for IVCA members. So there's AVCA, the American Veterinary Chiropractic Association, and then there's also internationally the IVCA, so International Veterinary Chiropractic Association. But when you have someone to come to work on your horse, always ask them about their credentials, always ask them if they're insured. Make sure that you work together with the primary veterinarian so that you have that the clinician, unless it's the veterinarian as well, has permission to work on the horse. And always make sure that it's not just a 10-minute job, but that the practitioner watches the horse move, so goes through a full assessment and then the treatment, and hopefully leaves you with homework as well.
Thank you. We have one question here about a foal that is now 7 months old, and actually did have some periosteal stripping due to some crooked legs. But the owner's just wondering, are there things that they can do at this young of age to still support that horse's ability to strengthen and continue to grow and heal?
I would say yes, it's hard without seeing the case per se. But I think anything most important, I would say, is keep it moving as much as possible. Within the limitations of it's hard to see or to say without seeing the horse. But I think one of the key issues that we see with horses, whatever the issue is moving away from stable rest wherever possible. So keep controlled movement, keep them active as much as possible, because again, at that age, you still have so much active growth, and bone is an active tissue, so it will react to loading. So I think it's very much an influential age to already address or to keep addressing it.
Okay, thank you. Are there any books that you recommend?
Oh, that's a broad question. Yes, actually, it's an excellent book by Deborah and Patillo from Equinology. It's called The Anatomy of Equine Bodywork. It will take you through, it's a really user-friendly book. It goes through anything from physiology to clinical conditions to body work for the horse, and showing the techniques as well to what is safe to use, when to call in colleagues, what different therapies are and how they can be applied. There's a section on lameness, on neurology. It's a really encompassing book and easy, good reading.
Oh, thank you. Dr. Sally, oh, go ahead, Dr. Rombach.
Sorry, so anyone who wants to look at that, if you look up equinology in a search engine, it'll come up, Equinology Institute. Yeah, that's probably my go-to Bible and manual, among others.
Dr. Skelly, are there any questions on Facebook?
No, not yet.
Okay. Question for you. Does age of the horse play a factor in how rehabilitation is addressed?
Very good question. And I would say yes. Especially when you're looking at the older horses, I'm very cautious with rehab to not do too much too soon. Or to change too much too soon, if that makes sense. For example, I'm dealing with a horse now. It's a 15-year-old horse that had a lower leg issue, and it's changing its shoeing. We're working on its core. We're changing how it moves, but I'm really cautious with how much I do at a time, mainly because the horse is older, and I think, it's easy to overdo things so little and often. So that's where assessment and reassessment are really important. And rehab is not linear. We all have this utopia of a beautiful line, from baseline to now we're in full work again. And unfortunately, it's a messy squiggle. So again, I think the most important thing is listen to the horse, look at the reactions from the horse, and to always, with every session, look at it fresh and really use clinical reasoning. So is a certain approach or a certain technique or a certain tool actually appropriate for that horse in that stage of healing?
Wonderful. Are you game for maybe a couple more questions?
Absolutely.
Okay. So do you have any recommendations for recovery and treatment after a hoof injury, such as an abscess, or recovering from laminitis?
Oh, well, those are two very different topics. So an abscess is obviously more acute, so it's much easier to work with. I'd much rather work with an abscess than laminitis. Abscess primarily is, again, finding the issue, pain control, and so I think that one's fairly straightforward. The laminitic cases are much more challenging. And not so easy to answer because, again, first of all, you'll want to work with directly with the veterinarian, look at radiographs, look at whether or not you have degrees of rotation, how far advanced the disease is. And that's really going to be a key factor in what to do. But so long as that horse is still in pain, I would be very cautious to do anything. And for example, a horse like that, particularly when even though it looks better, but you still have heat in the hoofs or anything like that present, I probably wouldn't be doing much with it until you have cold feet and you have, and pain is gone or has been addressed. I'd be very cautious with that.
What daily exercises might you suggest for the average sound horse in moderate work?
Wonderful. I love that question. So I'll talk you through what I do with my horses. Before riding each day, I do some soft tissue release along the neck and the back. Doesn't need to be fancy. Even good deep grooming does it. And then I follow it up with the tail shifts straight back and to each side for activation. And then they also get treats, so the baited exercises as activations. And then I include some abdominal lifts as well. And now that I have my fancy new wobble board, they will go on there before exercise as well. But the release and the activation for just about every horse is really useful, really nice. And also, the more you work on your horse, the more you'll pick up, oh, does the lower back feel a little bit tighter? So as owners, don't be scared to palpate your horse, to run over the muscles to see, is one more side more sensitive than the other? Does the tissue yield when I do a gentle massage? Or gentle, just, even long, deep strokes are absolutely fine. That's a nice way to release it. But always do those before exercise.